The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and thank you for signing up for this webinar. My name is Margaret Corto. I'm a Senior Program Analyst at the Office of Minority Health Resource Center. And the panelists for this webinar are Corinna Dan, Viral Hepatitis Policy Advisor at the Office of HIV and AIDS and Infectious Disease Policy, D'Angelo Green at the Centers for Disease Control, Melissa Baker at the National Black Leadership Commission on AIDS, and we have Tisha Bell, who is a community member who has a personal story to tell us about hepatitis C. And without further ado, I would pass this on to the presenters.
Thank you. I apologize. This is Corinna Dan, and I want to thank everyone on the phone for joining us today. I believe that I did not follow exactly the directions of my moderator, and I needed to pull up my slides. There we are. Good afternoon. So I'm Corinna Dan, and I wanted to welcome everyone to this presentation, this webinar on hepatitis C in African Americans. Today I'm going to talk about opportunities for action from the Department of Health and Human Services perspective, and then I'm going to pass it on to a colleague at CDC to share some resources, as well as our community partners at the National Coalition Black Leadership on AIDS, and then really want to thank Tisha Bell for coming on board today to share her personal story about hepatitis C. So I wanted to give a little bit of background about hepatitis so that we all understood or understand what we're talking about when we talk about hepatitis C. Viral hepatitis is a liver infection, and so hepatitis C can cause some symptoms when people are first infected. However, often people don't have symptoms when they're first infected with hepatitis C. Sometimes people have things like fever, fatigue, nausea, loss of appetite. The most commonly considered symptom is jaundice, which is the yellowing of the skin and eyes, but only about or less than 50% of people who get infected with hepatitis C have symptoms. Hepatitis C becomes a chronic infection in about 75 to 85% of people who get infected. So basically 8 out of 10 people who get hepatitis C develop a chronic viral hepatitis infection. Usually when people have a chronic hep C infection, they have no symptoms. But when they do have symptoms, they're often very mild, and they often they're often what we call insidious, where they come on very gradually and people don't even notice that maybe they're a little more fatigued than they used to be, or they have memory problems, or maybe more depressed. And people don't really relate those to a chronic hepatitis infection. I wanted to talk a little bit about the history of hepatitis C because many people remember when hepatitis C wasn't called hepatitis C. It used to be called non-A, non-B hepatitis before it was identified in 1989. Hepatitis C used to be transmitted through blood transfusion and other blood products before about 1992. So people who got blood transfusions or other blood products before 92 may have gotten hepatitis C through those procedures. Hepatitis C used to be very difficult to treat until about 2014 when new treatments became available. Hepatitis C was a problem without a solution until now. So a few more facts about hepatitis C. Hepatitis C is the most common bloodborne infection in the United States and is usually transmitted when the blood from one person who's infected with hep C gets into the body of someone who's not infected. in 2016, the most common way to get infected with hepatitis C is by sharing needles and other drug injection equipment. Hepatitis C is actually a very hardy virus, and it can live outside the body. It can live on surfaces, and so exposure to blood, even if somebody touches a surface that has blood on it, that may be a way that people can be exposed to hepatitis C. Hepatitis C can also be transmitted through unprotected sex, although that happens less often than through direct blood exposure. And hepatitis C can also be transmitted from an infected mother to her infant. The other thing about hepatitis C that's pretty amazing these days is that hepatitis C is curable. Current therapies cure about 9 out of 10 people after about 12 weeks of therapy that's usually 1 or 2 pills once or twice a day. So the things that challenge us about hepatitis C is that there are a lot of people in the United States who are chronically infected with hepatitis C, about 3.5 million people. And for people who are more familiar with HIV, that's 3.5 times the number of people living with hepatitis C compared to HIV. And again, most people don't know they're infected. So they don't ask for a test, they aren't looking for symptoms, and then they don't get educated about how to protect themselves, how to protect their livers, the fact that there are these treatments available, and other ways that they can stay healthier. A huge challenge in hepatitis C is that we've seen an increase in reported new cases of hepatitis C, a 250% increase between 2010 and 2014. We think that that's because the prescription opioid epidemic, with people starting to use oral pills and then transitioning to injecting drugs, has led to people being exposed to hepatitis C. Another thing that's a challenge in hepatitis C is that even though we have these amazing treatments, only about 9% of people living with chronic hepatitis C have been cured. And what we see in terms of deaths caused by hepatitis C is that death rate is going up. And in 2013, more people died of hepatitis C than all other of the 60 nationally notifiable infectious diseases combined. So we have a huge problem where people are chronically infected with hepatitis C. They're not getting diagnosed. They're not getting the care and the treatment that they need. They're not getting cured with these new therapies, and they're dying before they should be dying. They're not living as long as they could. They have worse quality of life because of hepatitis C infection. So why are we focused on hepatitis C and African Americans? What we've found is that hepatitis C is twice as common among African Americans compared to whites. Research has shown that African Americans are more likely to be diagnosed later. So we've got missed opportunities for diagnosis and prevention, as well as treatment. Approximately 75% of all people living with chronic hepatitis C were born between 1945 and 1965, the so-called baby boomer generation. And we see that among African American baby boomers, 1 in 13 is chronically infected with hepatitis C. That is higher than rates in that age group. And of course, when you're older, you're more likely to have had the infection for a long period of time. You're more likely to have developed some liver disease and liver scarring, and it's very important to get diagnosed. It's better if you can get diagnosed earlier. In African Americans, we also see that liver cancer and bile duct cancer are higher compared to non-Hispanic whites. We also see that among African Americans, chronic liver disease, which is often caused by hepatitis C, is a leading cause of death among, again, those people born 1945 to 1965. And those are preventable deaths. So in 2012, the CDC expanded their hepatitis C testing recommendations to cover all people born 1945 through 1965. Again, most of them are unaware of their infection. It's cost effective to get people tested because a liver transplant, which can happen if hepatitis C goes untreated and the person gets severe liver disease or liver cancer, can cost up to $500,000, whereas the treatment for hepatitis C costs a lot less than that. The therapies that we have now cure, again, 9 out of 10 people, and we want to treat people and cure people so that they don't develop liver disease and liver cancer and liver failure. There's a whole lot of other people who are recommended to be tested for hepatitis C. I'll leave this list up for a minute while I talk, but people who've been exposed to blood, and that includes anyone with a history of or currently injecting drugs, people who got blood or organ transplants before 1992, because 1992 is when we developed a test and could actually test for hepatitis C. Anybody who's been on chronic hemodialysis, because again, as I said earlier, hepatitis C actually is pretty easy to transmit, and hemodialysis is a process that involves a lot of blood, and so people on hemodialysis have been exposed to hepatitis C in the past. Infants born to hepatitis C infected mothers should be tested for hepatitis C. And people who have history of intranasal drug use, tattoos that weren't done using sterile implements or in basements or in jail or prison settings should be tested for hepatitis C. We see high rates of hepatitis C among people in jails and prisons, and so anybody who's been incarcerated should be tested for hepatitis C. As well, liver enzymes are often elevated or higher than they should be in people with chronic hepatitis C, and people who have those high liver enzymes should be tested for hepatitis C. The recommendation is also that anybody who has HIV should be tested for hepatitis C at least once when they're first diagnosed. And if people continue to have high-risk behaviors, then they definitely should be tested on a regular basis. So just wanted to mention those benefits of hepatitis C treatment. CDC will go on in a couple minutes and share more resources about that they've developed that can help teach people about hepatitis C and the benefits of treatment as well as the importance of testing. But the current treatments now work equally well in people with HIV, people of all race and ethnicities, and even people who have pretty severe liver damage, as well as other comorbidities. In the past, those treatments did not work very well in these populations in particular, and so it's a big change now that those people can be cured very safely with the new medications. We see almost a 75% reduction in liver cancer, a huge reduction in liver-related deaths, and if we were to test people, get them diagnosed and treated with hepatitis C therapy, we could potentially prevent 321,000 hepatitis C deaths and reduce the chance of people who have hepatitis C transmitting those their infection to other people. So I need to pass the slides over to the next presenter.
Okay, thank you, Corinna. Can everyone hear me? My name is
Yes, we can.
Okay, thank you. My name is D'Angela Green, and as Corinna mentioned, I am with the CDC, and I work in the policy office, and I'm a health communications specialist. So I've been asked to provide an overview of the various CDC resources available for education and training that's related to hepatitis C. So today I will cover information about the No More Hepatitis campaign, some of the African American focused resources that are part of the campaign, additional hepatitis C resources that are not African American focused, but that you may find useful. And then end my slide by sharing some of the available tools and resources, or training resources. Okay, a little information about the No More Hepatitis campaign, and I thought it would be appropriate to discuss the campaign because most of the materials that I will talk about today are part of the campaign. So the No More Hepatitis campaign is a national multimedia education campaign, and it's designed to increase awareness of hepatitis C and encourage testing of those born 1945 to 1965. There have been 3 phases of the campaign so far. Phase 1 rolled out August 2012, and then we had Phase 2 late January, early February of 2015, and then just recently the Phase 3 was rolled out April 2016. And then the target audiences for the No More Hepatitis campaign are consumers born from 1945 to 1965, as well as primary care providers. Okay. Then the primary campaign objectives are to educate persons born 1945 to 1965, also known as baby boomers, about CDC's screening recommendation, and also to encourage baby boomers to get tested. So there is a segment of the No More Hepatitis campaign that is designed to effectively reach African American males and females born 1945 to 1965. And it's important to target African Americans because hepatitis C disproportionately affects African Americans. And during 2008 through 2012, non-Hispanic blacks aged 50 to 64 years had higher rates of hepatitis C related liver cancer than other ethnic groups. So this particular slide shows all of the African American targeted materials that are available to you. All of the materials, especially the posters, have messages about hepatitis C being the leading cause of liver cancer. And then also there's we have buttons and badges that are available as well for your African American targeted outreach. And then I also just want to mention that these 3 posters will not be reprinted once they're out of stock. So I'm giving you the opportunity now to, please order the posters if you find that there's something that you need, because we want to make sure that you have an opportunity to order them. And I'll tell you a little bit later how to do that. Okay, and I want to switch gears just a little bit and now talk about some additional campaign materials that aren't African American specific, but that you should find helpful as well. So as you can see here, there are a wide variety of posters that are available to order for free, and they're also shipped to you for free as well. And then the next slide shows some additional posters, and these are actually some of the newer posters that just came out during Phase 3. And next, how you can order all of the posters that I just mentioned is through either of these websites. The very first website on the far left is actually a website where you can order all hepatitis related posters, and then the web address on the right will actually, you can order hepatitis specific materials, but then you can also order material of other disease types. So just wanted to mention that as well. Okay, and then we also have available video PSAs. So this is a snapshot of 2 video PSAs that you can view, and you can either view them on YouTube, you can download from your website, and they also have closed caption files as well. So these are available in a wide for use in a wide variety of ways. And this is a snapshot of 2 additional video PSAs, and the web link to those PSAs are at the bottom of the slide, so to make it easy to find. And then I just wanted to show you an example of one of the video PSAs that was downloaded and used on a website. And available to you are also radio ads and scripts. You can download and share recorded ads, and also you can send the scripts to local stations to have them read them on the air. And so they're all right here and available for you. And at the bottom again is the web link to the radio ads and scripts. So there's also a hepatitis C fact sheet on why baby boomers should get tested, and this fact sheet is available in English and Spanish. It's not available to order, but you do have the ability to download and print the fact sheet yourself. So available are also infographics. So we have 2 different size infographics that can be printed, or you can also screen save the JPEG to include on your website as well. So I also wanted to share with you all of the wide variety of digital buttons and badges that are available. And the buttons and badges, you can actually put them on your website, and once you click on one of the buttons or one of the badges, it will take you to either the video PSAs, to the risk assessment, which I'll mention a little bit later in my presentation, and also some of the buttons and badges will link you back to the No More Hepatitis campaign. So there are also email signatures that are available that you can include in your outgoing emails. And then I just also wanted to mention that all of the materials are in the public domain. I tried to include URLs to all of the materials, and we encourage you to use the tools and resources that meet your needs. And I also want to mention that there are branding and usage guidelines. So if you're in doubt on how to use the material, we ask that you please resort to the guidelines, or feel free to contact me and I can direct you in the right direction. And then we also have some training resources that are available. Specifically, there is a serology training on this website that covers hepatitis C, and these are professional resources. And then we also have a hepatitis C online, which is a free educational website that was developed by the University of Washington, and they actually have a cooperative agreement through the CDC. This site is a comprehensive resource that addresses the diagnosis, monitoring, and management of hepatitis C virus infection. And I provided the web link to the online training as well. And then lastly, I'll quickly go through the last 2 slides. And I wanted to make you aware of the hepatitis risk assessment. And this is an easy-to-use online tool that's designed to assess a person's risk for hepatitis A, B, and or C. The audience for the risk assessment are baby boomers, Asian Americans, and people with past risk behaviors or events. The online tool can be used in the privacy of a person's home or at a doctor's office. And then once you answer a series of questions, it'll provide tailored CDC recommendations. And these are recommendations that you can talk with your healthcare provider about. And then we have the risk assessment promotional tools, which are the buttons and badges that you can include on your website. All of these buttons and badges link to that actual risk assessment. And the only thing you have to do is just copy the code onto in your web address. It's not the web address. And it will upload onto your website, and a person who's visiting your website can click on the link and it'll take them straight to the risk assessment. And then here's an example of one of the California Department of Public Health who uploaded the badge onto their website. And then there's also a Get Tested site, which is a comprehensive testing site for consumers. And at this site, people can enter a zip code and find free testing and vaccination locations in their area. And then at the bottom is actually a button that you can also upload onto your website that will take visitors to your website to this Get Tested site. And I've provided the web link below. Okay, so here's how you can stay connected to all of the CDC messages and information about hepatitis that's going out. CDC has a Twitter account, or the Division of Viral Hepatitis has a Twitter account. It's called @CDCHep. So if you have access to Twitter, we ask that you follow us there. And you can also sign up for Gov Delivery to receive email updates about new publications, recommendations, new materials, and other significant events. And then it would not be fair for me not to mention World Hepatitis Day, being that it is coming up in 8 days. The purpose of World Hepatitis Day is to raise awareness of the problem and what needs to be done to strengthen efforts in prevention, screening, controlling, and eliminating viral hepatitis. And the theme this year is No Hepatitis, Act Now. Okay, so now you are in information overload, but the slides will be available after the webinar for your reference. Thank you for your time. Now I'll turn it over to Melissa Baker.
Hello, Ms. Baker.
Can you hear me now?
Yes.
Can I hear?
Thank you.
Okay. Okay, thank you. Sorry, I had too many mutes on there. So good afternoon, everyone. I'm Melissa Baker from the National Black Leadership Commission on AIDS, and I am happy to join to be a part of this webcast this afternoon. I'm here today to talk about the 4th Annual National African American Hep C Action Day. and to give, the hopes is to give some information about the actual day, how it came about, and also talk about how we look to grow and hopefully have more organizations participate. There we go. The National African American Hepatitis C Action Day. In 2013, we, NBLCA was approached by COPE. COPE is a organization, Coalition on Positive Health Empowerment and Harm Reduction Coalition, and we had a discussion about the impacts of hepatitis C on the African American community and the need to bring more attention to the actual virus in hopes of getting more people tested and into treatment. We purposely came up with the Action Day as opposed to Awareness Day because the goal was to get people involved and out in the community doing work to bring attention to the particular virus. So the purpose of National African American Hep C Action Day is to raise awareness among healthcare professionals, policymakers, and of course those who are at greatest risk, as well as to bring significant impact as regards to getting people tested and linked to care and cured. The great thing about it, when we started in 2013, the new drugs were coming about, so as we moved forward, it was nice to see that there was a drug that the African American community that could actually take the drug with less side effects. So that was exciting. So as the Action Day evolved, that was something that we were able to talk more about as far as getting people cured when we get them into treatment. So Action Day's purpose, as I mentioned, educate and empower leaders to mobilize the Black communities. We wanted to encourage testing, we wanted to engage policymakers, and we wanted to advance legislation. What we realized is as the medicine was evolving, unfortunately, a lot of healthcare providers were not aware of what was going on. A lot of the legislators were not aware. So it was our goal to take this forum and really bring attention to not just the community, but those that are in positions to make decisions to get people into treatment, to get funding to provide that treatment. So that was a big part of this as well. Some of the actions that we talked about were, it's important, of course, outreach and testing events. Hep C literacy is very important, social media, town hall, and policy interventions. And what we found is a lot of organizations with outreach and testing, we were encouraging them, of course, to do their traditional health fairs, in addition to do more targeted testing, specifically targeting the baby boomers, going into senior centers, using the epi data provided to you based off of zip codes, where they're seeing higher rates of hepatitis, going to substance abuse programs, doing some kind of the pop-up guerrilla street testing in various areas depending on the time of day, around bus stops, subway stations, food pantries, things like that, to really focus on the particular part of the population that needs to be tested. In addition, we encourage people to do hepatitis health literacy. We realize that education, getting things into people's hands, I know D'Angela just went over all of the great tools that the CDC has to offer, and we fortunately have been working with them. They've been a great partner to Action Day in providing resources for the Hep C literacy. We print palm cards which have risk assessments. Each year we print about 10,000 palm cards that we distribute not just through Action Day but throughout the year to various organizations across the country. We provide posters for people to be able to advertise their Action Day activities. So we print those and provide them to them as well. We've hosted webinars that talk about the need for African Americans to be in clinical trials. We've hosted webinars to just talk about the impact overall and the best way to advocate for hepatitis legislation. So the education piece is really important. We each year we do PSAs that talks about the impact of hepatitis in the Black community, and those have actually been very well received. What we found from sending them out is a lot of the radio stations have said that although PSAs are they have so many they have to use, many organizations do not take advantage of the free airway. So that's a great tip for those of you who have local stations when you're wanting to advertise any of your activities, to reach out to your local radio stations to take advantage of that. But PSAs, we've done bus shelters, billboards, which have brought a lot of attention. We've gotten a lot of great feedback. We did it a couple of years ago, and we continue to have people comment about the bus shelters and billboards. When Action Day comes up, they always refer back to, I remember when you did the bus shelters, and so that was their introduction into it. The bus shelters were selected in, of course, areas where we do see high rates. And between the bus shelters and PSAs, since 2014, we've reached over 12 million people. So that's a really good thing as far as impressions. Social media is a huge part of this as well. We encourage our participants in Action Day to take advantage of their social media followers, because as we know, social media is a great way, and many people get their information from social media. We use Facebook to advertise, of course, Twitter. We put together social media messages that we provide to each participant that signs up for Action Day. We have been fortunate enough to also partner with NPEN and the CDC to be a part of their Twitter chats, which has brought a lot of attention to Action Day. And it's just a great way for us to connect with other organizations who are doing this work. And it's also a great way for the organizations who are doing the work to kind of get their word out. So the social media piece has been a great part of it. We have recently started an Instagram page, which we've been taking advantage of. In the past, we've used Storify to do more of that, but we are using Instagram this year, and we look forward to seeing how that evolves. But I think what we realize is social marketing is a great tool for a lot of our organizations, but we also want to, and we've started trying to figure out ways to really target individuals, but because a lot of our feedback on the social media are from organizations, we want to see that the message is really getting to the public. And so a lot of our data that we're focusing on this year will be to see how it's actually impacting that particular part of the community. The other item is policy intervention, which I spoke about, but it's a great opportunity again for in your particular city to do meetings, to host town halls, to speak to the community, to educate your elected officials. Many states still do not have legislation which makes the testing mandatory, so it's a great opportunity to bring that to their attention. We've hosted press conferences. Other organizations have hosted press conferences to bring attention to the impact of hepatitis C in the African American community. And what you will find is it's often a great way to kind of build relationships with your local elected officials and start to provide them, electronic briefs on what's going on nationally. We do a lot of that, and we actually get feedback from various elected officials asking us for other information. So it's a great way for organizations to connect with their elected officials and be looked upon as an expert in their area, and in hopes that that will help them in other ways, whether it be funding or legislation. One of the things that Action Day fortunately brought about is last year for 2015, we actually announced an initiative in Tuskegee, Alabama, in collaboration with Mayor Johnny Ford, as well as numerous community partners. And the idea was to promote awareness and draw attention to the health disparity of HCV, but more importantly, to bring attention to the impact of the virus on the South. Out of that a year later, I'm happy to say the initiative has actually taken off. We are doing a kickoff on July 25th, 2016, which is this coming Monday in Philadelphia, and it's during the time of the National Democratic Convention, and the goal was to do it in the city in hopes of bringing more attention to hepatitis C and the impact that it has on the communities. So we will be hosting a webinar. We'll have a press conference, and that information is available, and I know that I forwarded on, and so you will get a notice about the actual activity that's taking place on Monday. If you're in Philadelphia and you're interested in coming, please do come and participate. Otherwise, we will be doing a live webcast, and we hope that you all will be able to join us. And it will be speaking, they will be talking about the organizations who are part of the Southern Initiative. We'll talk about how they actually got it up and going, what the goals are, what they've accomplished to date, and we hope that what they share with us, you all will learn something from it, and then hopefully they will learn something from you as well. So National African American Hep C Action Day, we actually started, as I mentioned, in 2013, and we went from 7 states, 8 cities, and 13 organizations to date we have 22 states, 50 cities, and over 90 organizations that are participating this year. So the day continues to grow. Which is really exciting because I know when we first started, we thought in 2013 to have 7 states was a huge deal because we started very late. It was a very soft rollout. So to actually see it evolve and include, states from, we had Hawaii, which we're exactly excited to see come on. We've had Nebraska. So it's as you can see from the list, it's a variety, a mixed bag of states that are participating. Our goal is to eventually, and I'm sure there are probably activities taking place in other states that we may not know about, so if you are in a state and you don't see your state here, but please let us know about what you're doing. We'd like to hear and to communicate with you. And this is something familiar that you just saw. I wanted to share with you some of the things that we use. We provide in 2013, as I mentioned, we started, and it was just basically press conferences and whatever activities each organization could do. We've evolved into now having an online toolkit, and we provide marketing materials to organizations, and we usually have a certain number we set aside, and for the first ones to enroll, they get t-shirts to help promote their activities, they get posters, they get palm cards. We try to provide them some marketing materials to make the event a little more marketable. We were fortunate enough, this is a poster that D'Angelo shared earlier from the CDC. In 2014, they branded it for NBLCA, and it has been a hot ticket. I know they're taking it out of publication in the future, but as long as we continue to have people who really like the poster, we actually print them ourselves and share them with the community. So this is one of the marketing materials that we provide. And this is just to show some of the things that we've done as far as public forums. When we rolled out in 2014, we did a breakfast in Harlem that included executive directors, elected officials, community-based organizations who have been doing the Hep C work for a very long time. And at this particular event, we honored Hadia Charles, who at the time was with Harm Reduction, and she's now with OraSure, and Vocal New York. And for those of you who are aware of Vocal, who are not familiar, Vocal is a very, very it's a great organization in New York City that does a lot of advocacy work around hepatitis. And this is just a picture of one of the screenshots from when we do a lot of our social media. This was one of the that came through, and this is from the NPEN Twitter chat. So just to kind of give you an idea of the different things that we have done around social media and marketing materials. And so 2013 and beyond, what I want to just say to everyone in hopes, our goal is to really grow this, but not just it be about Action Day. And I've had numerous conversations with another great partner of ours, NBHR, Tina, over there. And I said to her, it's our hopes that we can continue to do things with organizations outside of Action Day, because we realize there's a huge need. So that's what I'm hoping that we can do. We can come up with a few things that we can work on throughout the year after Action Day that leads up to the following year. So in 2015, we sent out a brief survey, and the feedback we received was that the organizations, 73% of the organizations organize outreach and testing events, 53% of them organize health literacy events, and 49% of them organize social marketing events. All the organizations reported that they serve African American populations, and 50% of them were community-based organizations. Based on the survey completed by participants, Action Day played and will continue to play an important role in increasing awareness and testing of hepatitis among the African American community. It is our goal to work with many of the organizations, as I said, throughout the year, to help them build upon whether it's legislation, whatever their policy needs may be, whether it's getting funding for testing. I think it would be good for all of us involved in order to see that this is actually evolving and helping people throughout the year. And so that's it.
Well, thank you all very much. That was, I'm muted, okay. Thank you very much. And now we can have Taisha Bell, who is going to tell us a personal story.
Good afternoon. My name is Taisha Bell, and I'm going to tell you a little personal story about myself. Oh my goodness, that's me, Taisha Bell. I was diagnosed in 2004 with Hep C. It was very difficult to accept the diagnosis at that time. The doctor had explained to me that I probably had Hep C for numerous amount of years and just didn't know it. Still not wanting to accept the fact that I now have Hep C, I continue to drink beer. Yes, that was my choice of drink. I like that poster that D'Angelo and Melissa came out with when I was young, I hit the streets and they hit me back. Well, anyway, in the 60s, there was no test for the hepatitis, and the hepatitis C can also begin as an acute infection, but in some people, the virus remains in the body, resulting in chronic disease and a long-term liver problem. There are vaccines to prevent hepatitis A and hepatitis B, but however, there is no vaccine for the hepatitis C. As I went on living my life and still drinking beer, that was my drink of choice, as I said. In 2006, I was referred to Grady Liver Clinic, and I met with Dr. Miller. By then, I was at stage 2 of hepatitis C. As time went on, mentally, I was feeling very depressed. I stayed in the bed all the time, and I thought about dating and how can I tell, you know, the man that I was dating that I had this virus, and I was very upset with myself, you know, and I just didn't know what to do. I was very depressed. My only symptom that I had with the hepatitis C was throbbing pain under my right breast. Also, at times, I would feel like tremors and sharp pains in the right side that would make me just have to stand still until the pain subsided. There really aren't any symptoms for this hepatitis C, most people with chronic hepatitis C do not have any symptoms. However, if a person that has been infected for many years, as I was, okay, my liver, I believe, at that time was getting damaged. In many cases, with there being no symptoms of this disease until the liver is damaged, okay? Hepatitis C is often detected during a routine blood test to measure liver function and liver enzymes. We, as African Americans, need to check on this periodically, I feel, okay? Sometimes when you go into your doctor's office and you have your blood tests and so forth, you never mention to the doctor about my liver enzymes. And I believe that that is something that we, as especially black women, we need to ask our doctors to give us this type of a test so we can be aware, because it's a quiet virus. You know, it's one of those hidden viruses that you don't know about it until you get tested. Well, I had taken the first treatment, and it didn't do too good for me at all, okay? And I was very much afraid to try the new treatment. Well, I finally tried the new treatment, and I'm so glad to say I don't have hepatitis C anymore. Yes, the new treatment, it worked. I had to take meds for up to 12 weeks. It was just taking the meds every day at the same time, constantly, okay? And the only thing about these new meds, the new treatment, was I was told by the doctor to stay out of the sun. Okay, that's the only thing. But outside of that, after the 12 weeks, I was cured. I no longer have Hep C. And ladies, I have to tell you, I'm so glad to be cured from Hep C. My doctor can tell you, I told my doctor one time, I said, you know what, I'm not wearing nothing yellow. I don't buy nothing yellow. I don't wear nothing yellow. I don't like seeing yellow, because I kept thinking I got hepatitis C. This jaundice is going to come up in me and I'm going to be yellow. So I just stopped buying everything yellow. But I tell you, I'm so thankful today that I listened to my doctor and I followed through with that second treatment. I hope that my journey with the hepatitis C will help African Americans to get checked, to specify with their doctors again, okay, what is my liver enzymes? What is the count? We should be aware of that. Also, we should be aware of our kidney count, okay, just to be on the safe side. We need to make sure we get this checked out, okay, because as I said, it's a silent virus. We don't know we have it. It doesn't come with symptoms, okay? So we need to get checked and ask our doctors about this. And I just want to let you know about some of the symptoms of hepatitis C. As we know, as D'Angelo said and Corinna had mentioned, when your body is going through a fever and you don't know why you're having this fever, and you feel tired all the time, you get fatigued and you just don't know why you're tired. And actually, you know, as I'm speaking to you right now, I can remember when my knees, my joints, okay, got kind of stiff and everything, but I never put it together with this hepatitis C. At some time or another, I did feel a little nauseated, but still, all in all, I still never put it with this hepatitis C. So once again, I just implore all people, especially African Americans, because I'm realizing now and I'm learning that it attacks the African American community much quicker than any other type of community. So we really have to just pay attention to our bodies. You know, sometimes we just don't pay attention to our bodies, and our bodies will tell us what is wrong. And then sometimes when you know you've been in the street, okay, and I'm 65 years old, okay, so I used to hang out in the streets in 1960s. Okay, I'm a Brooklynite. I'm from New York City. So that's what we did. We hung out in the streets, okay? And there are a lot of people, including myself, that did go into injection drugs, okay? And as this poster says, when I was young, I didn't know, but I hit the streets and the streets hit me back. So in 2006, the streets hit me back. Okay, they told me that you didn't do the right thing at that time. So I am a patient that had hepatitis C, and I will shout to the rooftops, okay, that we as black people, we need to get this checked out. We as people need to get this checked out. Hepatitis C is a silent virus, and you need to get this checked out. Your liver is a vital part of your body. You have to take care of it, and one way to do this is to get yourself checked. I thank you, ladies, for allowing me to come in here and tell you my little story. Yes, I do have more that I can bring to the table, so if you need me, please do go ahead and call me. Once again, I thank you. I thank you, Corinna, and I thank you, Ms. D'Angelo, for taking the time and having me to present this story. Thank you, ladies. Good afternoon.
Thank you so much, Taisha. Thank you for sharing your story. So I want to go ahead and this is Corinna Dan back again, and I just wanted to spend just another 2 minutes talking about taking action. I think Taisha's message was right on point. We want people to get tested for hepatitis C. If you have elevated liver enzymes, for sure you need to get tested. But many other people, you know, don't have any symptoms and can get tested even without that. We do have a National Viral Hepatitis Action Plan. That action plan includes that same message. Everybody needs to get tested for hepatitis C who was born between 1945 and 1965. Anybody who's ever injected drugs, even just once, even a long time ago, it is better to know if you have hepatitis C because we can do something about it now in 2016. The action plan underscores that we need partners. We need partners like CDC, like NBLCA, like individuals like Taisha Bell. We need organizations to help us to spread the word. We want to get those key messages out into communities, especially the African American community where we've seen more liver cancer and more death due to hepatitis C than in other communities. So get tested. If you don't have a regular doctor, you can go to CDC's NPIN at this address and find a testing location near you. Find out if your insurance will help and cover screening tests, vaccinations if you haven't gotten them before, as well as care and treatment. What can you do? You can tell personal stories or tell the story of a loved one who has hepatitis C. It makes it personal. It makes it relevant for others when you are able to tell personal stories. Many people don't know that hepatitis C is curable because it didn't used to be as easy to cure as it is now. So helping to spread the word that those cures are out there. As Melissa was talking about, using social media, using your networks to get the word out about hepatitis C is critical in spreading the word. And I want to echo all of the presenters today with my thanks for your commitment and your joining in on National African American Hep C Action Day. I appreciate that all of you can help us put more action into this problem and help save potentially hundreds of thousands of people in the United States by getting them tested and into care and cured for their hepatitis C. Thank you.
Yes, and this is Margaret Corto. I want to thank the presenters very much for this very informative webinar, and also Taisha Bell for your story. It was very moving, very touching, and I'm sure most of us have learned a lot from there. Maria, do we have some questions?
Yes, we do. We have, one of them is pretty easy to answer. It's someone who wants to know if the Hep C websites have been updated to include information on DAAs.
So this is Corinna. I believe, yes, that CDC's website does reference the fact that hepatitis C is curable. You know, our HHS websites don't have a lot of details about the specific companies that have Hep C cures, but our Food and Drug Administration does have a website that it specifically talks about the new DAAs, and they make announcements when new drugs are approved or when changes are made to the labels or the directions to take the medications. So it may be useful for people to look at the FDA website. And I don't know if Melissa's organization may have additional information about the DAAs.
Thank you.
Thank you.
The second question comes from the 100 Black Men of America, and they are doing outreach in Alabama and in Grenada, Mississippi, and they want to know if Hep C testing kits are available for community organizations.
This is Melissa. Am I muted?
No, we can hear you.
Okay.
We hear you, Melissa.
Okay, hi. We actually have a few left that like I said, every year for Action Day, I try to set aside a budget for some. So if I could get his information, I could probably provide a few for them.
Thank you, Melissa.
All right, our second question is, what does the treatment do for the damaged liver?
So this is Corinna. What generally happens is that the new treatments eradicate the virus, and the virus is what's causing ongoing damage in the liver. What we've seen is that once people are cured of their hepatitis C infections, their liver actually regenerates some healthy new cells. Now that's not instantaneous. It does take a little while, but it's actually pretty wonderful that in some cases fibrosis or scarring of the liver, cirrhosis, and liver damage can be reversed by getting the cure for hepatitis C. At the same time, then, if you really want the damaged liver to get better, you also have to make sure that you're, eating a healthy diet, maintaining a healthy weight, and being very careful with what you put in your body, because other things like alcohol and some medications like acetaminophen or Tylenol are also potentially damaging to the liver. So there are a lot of things you can do in addition to getting the treatment for hepatitis C, but getting the treatment for hepatitis C can be a start to reversing liver damage caused by chronic Hep C.
Thank you.
Right, and another question we have here, one that says, as African Americans have higher rates of Hep C, are there lower cure rates for African Americans with current treatment?
That's a terrific question. Again, this is Corinna, and what we've seen with the current treatments is that they work as well in African Americans as in other people of other race and ethnicities. I think that because these treatments are fairly new, we need to do more studies and learn if there are differences and there may be small differences, but we haven't treated that many people yet, so we wouldn't know all the very, in the weeds details. However, during the clinical trials and as these treatments were being approved or considered for approval, it has been shown that they work equally well in African Americans as in any other population. And that's a huge change from the old interferon-based treatments, which worked much less often and cured many fewer African Americans compared with other people of other race ethnicities. And so we've got a real opportunity with the new direct-acting antivirals, the new therapies for hepatitis C, to cure African Americans who have chronic infection.
Thank you, Corinna. Maybe you can have one more question, and then we have to close. Thank you.
Right, so our final question is, are there any specific risk factors for transmission within the African American community, or are risk factors the same as the general population? And it says here, sharing injection drug equipment, unlicensed to use, blood transfusions before 1992.
I am not aware of any special or different risk factors among African Americans for Hep C transmission. It's basically blood exposure. But I don't know if D'Angela or Melissa, your experience has shown anything different?
This is D'Angela. No, the risk factors are the same for all racial and ethnic groups.
Okay, ladies. Thank you very much, and thank you to the listeners. We're very appreciative of you taking your time to listen to this webinar. And if you have any further questions, Maria, they can still send in the questions. Is that correct?
Yes, they can. And if you sent in a question today and we didn't get a chance to answer it, those questions have been saved, and I can forward them to the presenters so that they can be answered. We can answer them via email. All right,
Okay.
so thank you everyone for joining us today. Thank you, Corinna, D'Angela, Margaret, Melissa, and Ms. Taisha. Thank you very much to all of the people who showed up today and who stuck around till the very end. Have a great day.
Thank you, Maria.
Thank
Thank you, Maria. We appreciate it.
Bye-bye.
You're welcome. Farewell, everyone.
Okay, bye-bye.